All right, so now we're going to be speaking to Dr. Lindsey Zubritsky. Thank you so much for being here and for sharing your
Sure.
knowledge with us. Dr. Zubritsky is a board certified dermatologist. She is based out of Pittsburgh, Pennsylvania, and she does cosmetic derm, general derm, surgical derm, and she sees both adults and pediatric patients as well. So, hi, Lindsey, how are you doing?
Hi, good. Thanks so much for having me. I'm so excited to be here. It's such an honor to be invited to participate in something as big as this.
And thank you for being here and thank you for spending time. Tell me a little bit about yourself and what brought you into this field of medicine.
Yeah, so I'm actually born and raised in Pittsburgh, Pennsylvania. I did my undergrad here, a small liberal arts school. I always knew I wanted to be a doctor. So ever since I was the age of 6, I grew up going through my grandmother's nursing journals and magazines and books and everything. So I knew I wanted to be a physician. So it wasn't until maybe like early teenage years that I realized I wanted to be specifically a dermatologist. I was always just very attracted to the field where you can diagnose something just by walking into the door. So I thought that that was so magical to be able to just know something immediately and to be able to help so many patients, especially when it comes to the organ system. That's the biggest part of the body that you can literally see. So a lot of people care so much about it because it's something that they can see and they think about all of the time. But that's why I'm interested in derm. But a little bit more about me. Like I said, I'm from the Pittsburgh area, but I went to Penn State College of Medicine for medical school, which is where I met my husband. We ended up couples matching together, and we spent 4 years in Ohio. I did my residency at the University of Cincinnati in dermatology, where I was the chief resident. And then fortunately, my husband and I were able to move back to Pittsburgh. He is now a cardiology fellow at UPMC. So it's a dual physician household. So we have a lot of interesting conversations at dinner time. We don't have any children yet, but we do have a 3-year-old puppy who is the light of our life. So that's kind of like our practice before we have kids. So
No, that's great. And hopefully not too many loans either with that dual.
right. That's
That's
where it gets a little
I
tricky.
know I know that loan environment way too well.
Yeah.
But well, yeah. So I think something that you mentioned just now is really relevant, which is derm is certainly not something frivolous, and I think sometimes a lot of people may think that, and it's certainly not. It's something that we look at every day, and there's some very serious skin disorders. And one of the reasons I reached out to you to speak with us today is because we're entering a whole new world with COVID-19, and we're entering a world where masks are going to be part of our lives
Right.
for we don't know how long, and it's really important for us to be able to protect ourselves, but at the same time, there are people that are going to really suffer from skincare problems because of chronic mask use,
Right.
from healthcare providers, obviously, who are going to wear them a lot more, or essential workers who are going to wear them a lot more than someone who's just using them when they need to as they go out. But so there's a real potential problem in dermatology that could be arising with this chronic mask use. So before we sort of get into your thoughts on that, any commentary just on that in general?
Right. So I've actually taken a big interest in this topic. Starting back in March, I was having a lot of my fellow physician friends from medical school text me, call me, and just ask me these questions that they were saying they've been wearing these N95 masks and goggles and this occlusive PPE that had caused so many skin issues. And they were asking me, how can I fix this? How can I prevent it? How can I help this? And so that's what really got me interested in this. And there is absolutely a need and a crisis going on in regards to skin issues right now for not just our healthcare workers, but now non-healthcare workers, as many states are requiring the use of masks as we go outside and venture outside of our house when states start to slowly open back up. But back to healthcare workers, as you mentioned, there actually was a study published in JAD, which is the Journal of the American Academy of Dermatology, which is our big journal in our field. And the study had found that 97, so almost every single healthcare worker on the front lines suffered from some kind of skin issue. So the problem
Oh,
is there, it's relevant, and it needs to be addressed.
Yeah, that's pretty much everybody.
Right. Exactly.
What I wonder what the other 3% are doing, but
Yeah, right. They're probably not wearing it, right, to be
yeah.
honest.
Like,
If
are
you've
you
ever
wearing
worn
it
an
all the time?
right, if you've ever worn an N95, you know that you're left with marks at the end of it. So
Yeah, I've been fortunate to only have to wear it for a short period of time because, as you know, I mean, before COVID, we generally wore it for pretty rare things like tuberculosis, which
right,
was not really common.
correct.
And so even when I would go to see TB patients in the hospital, maybe I had it on for 15, 20 minutes and then, take it off. So it's definitely a new world. And in addition to healthcare workers, I think this conversation is going to be very relevant for essential workers who are sort of out all the time doing their job, who have to have masks on as well in order to, help us as a society continue to function.
Right.
And so lots of gratitude to everyone out there that's sort of doing all these jobs that are allowing us to continue on as a society in general. So let's get into it. I mean, let's first talk about timeline. So what kind of hours are we looking at when we start to see those skin changes start to happen, or people really reporting difficulty with their skin?
Right. So that study that I mentioned actually talked a little bit about that. So about the 6 hour mark is when you really start to see really severe skin issues with that. But with that being said, that's more, there's a lot of different skin issues you can have right now, and a lot of them overlap. But I will say that there's the different types of skin disease that we're seeing are different compared to our healthcare workers and our essential workers and our frontliners who have to wear it for prolonged periods. Their skin issues are a little bit different than those of us who are non-essential, who are wearing it, maybe for less time. So just different skin issues, but it could happen at any point in time, but 6 hours seems to be when you really start to see the severe skin issues from it.
Okay, and what sort of are we talking about when you're talking about those skin issues?
So, like I had mentioned, this is more in our essential workers, our frontline healthcare workers, mostly wearing N95s and goggles. So you also have to remember that goggles cause this too. And actually that study showed that goggles cause more damage than N95s.
Oh.
But so that was, I found very interesting. But regardless, these masks, what they do is they indent in the skin. And so they cause pressure on the skin, and constant pressure and friction and moisture is a bad combination for a healthy skin barrier. So these patients and frontline healthcare workers and essential workers, they start to develop ulcers, abrasion, tears, and then the epidermis, which is the top layer of our skin, starts to shred away pretty much. And so that's where you start to get, like I mentioned, these erosions, and it pretty much just strips away any protective skin barrier that we have.
And you can see that like as soon as, like, even just after a week's use, or?
Oh yeah, pretty cool. But it depends on the person's skin, their age, how they treat their skin. So there's a lot of factors that go into it, and what kind of environment are they in. So if they're rushing around the hospital doing CPR or something like that, or they're in the ER running from room to room and they're sweating a lot, that's going to cause quicker breakdown than someone who is sedentary and not sweating and has the ability to move the mask around and take it off. So we do see those who are in a more humid environment, who are sweating more, who have to wear the mask without touching it or taking breaks. We see more severe skin issues in those type of people.
Yeah, and I think that's a huge problem because, we're really encouraged to not touch our face, even with the mask on, obviously, because you don't want to touch something that's contaminated and then contaminate your mask. So taking the mask off, as simple as it sounds, is actually a big barrier to letting your skin breathe.
You're right, especially when you think about those who are essential employees, frontline healthcare workers. They could have just walked into a COVID room and they could have potentially COVID on their hands, and they don't have the ability to take the mask off and have a breather. They have to keep it on for their own safety and their own protection.
Yeah. And what are some of the things that we can do for the N95 specifically?
So there's a lot of different things, but I always say prevention is key. So once you start getting that skin breakdown, it's much more difficult to rebuild and repair and rehydrate that skin barrier than to just protect it from the gate.
Mm-hmm.
So unfortunately, a lot of people ended up in the realm of the damage until they asked, but I do feel lucky that we got the word out there pretty quickly once we started to see that this became a problem. But there's a good skincare regimen that I like to tell my frontline healthcare workers or even just essential employees who are wearing the N95s a lot. So before shifts, I always recommend just gentle cleansers. You want to wash your face, get off any dirt, debris, bacteria, makeup, residual makeup. And then you do not want to put anything on your skin other than a non-comedogenic moisturizer. So I tell all my women, or even men who, if they do this, no makeup. So now's not the time. No one cares what you look like. We're all in quarantine. You know, let your skin breathe. We don't need that extra dirt and debris and makeup clogging up our pores and leading to more issues. So go into work with a bare face. And then if you don't have any abrasions or any issues as of yet, then like I said, a non-comedogenic moisturizer, you can even put like a zinc oxide barrier paste where the mask rubs or where the goggles sit. So it's really important that you only focus on those areas where there's contact. So you don't want to use something as so thick as like a Vaseline or an Aquaphor all over the face, really just areas that it touches. And if you use something like a zinc oxide, it helps with lubrication, it glides along the skin, it's occlusive in nature, so it helps prevent and it helps to heal simultaneously. Now, with that being said though, you have to keep reapplying something like Aquaphor Vaseline or zinc oxide barrier paste. So it might not be something that's realistic for those who are wearing the mask for several hours at a time, because that will only last, you know, an hour or two until you need to reapply. So if you're in a field where you can take breaks, you only work for short periods of time, that's fine to use. But for most of our healthcare workers or people who are on the front lines, they can't do that. Right. So I like anything that's silicone based. Silicone's pretty gentle on the skin. So they do make silicone tape. They make a Mepitac tape, which works really well. And then they make something called a no sting barrier film, which works, and something like a hydrocolloid dressing like Duoderm extra thin. So these are actually physical barriers. And I tell people to put them, like I mentioned, over areas that the mask sits where there is pressure and when there's contact with the skin. So that tends to work really, really well. The only issue that I remind people is potentially, it could interfere with the seal of that mask. So you just have to be really careful and consider getting another fit test with it. But I haven't heard of anyone truly having issues. So that's why I recommend the Duoderm extra thin. So the thinner, the better, the less likely that is to interfere with that seal.
So they would just put the tape here, basically, and then any other pressure points that they felt like were. Yeah. And then ideally, again, we would get fit tested again, because obviously there's no point in wearing it if it's not working correctly.
Exactly.
And when you said the zinc oxide, you said zinc oxide barrier.
Yeah.
Is that just something they could buy on Amazon or what? Yeah.
I think it's pretty much similar to what parents use for diaper rash. Okay. It's like a butt paste almost. You can even look for that, but it's pretty easy to find. You can get it at any CVS, Rite Aid, any pharmacy store. So
and if someone has I have makeup on right now, but I actually, do get a lot of acne and skin lesions. So my skin tends to be a little oily. Is putting that sort of thick paste gonna, any specific recommendations or different recommendations for someone with more oily skin versus drier skin?
Yeah, so you're absolutely right. So when you use something that's very thick, especially like a Vaseline or an Aquaphor, which is ointment based, that is very occlusive and it can block the pores. So yes, that can definitely lead to acne. So if you are already acne prone and you're already starting to develop acne mechanica from this, which we'll get into later. We'll talk a lot about that. I would recommend then just going straight for the silicone tape, the Mepitac tape, or the Duoderm.
Okay.
It's like physical barriers should help.
And what about the regular mask? So, obviously not all of us are going to be wearing N95s. What about just like the cloth mask and the surgical mask that people are wearing?
So you also have to consider with any kind of mask, even if it's not an N95 that's sitting very tight, but if you're wearing it for a prolonged time, you're going to get erosions behind your ears. Okay. So that ends up being really painful too. So some ways around that are people have used foam back there, just cut some foam and put it so that it rests on the foam and not on your ear. So it's all about preventing that pressure and that direct contact. And I've also seen these plastic loop holders that people are selling on social media, but they're also, it was actually in my JAD dermatology journal, where these plastic loop holders that you put behind your head and you loop the ear loops into that. So then that takes the pressure off from behind your ears. And same goes for the goggles. So you can use something like the foam to prevent the pressure from the backs of the goggles too.
That's great. People are getting very creative.
They are, yes. They're being forced to. So it's working.
I was watching the news, and there's this mask that's being developed somewhere where it opens when you want to eat. Have you seen that? Although I don't think, the food was kind of touching the mask on its way in. I was like, I don't know if that's exactly safe, but people are getting creative. I appreciate their inventiveness, I guess is the right word for it. But okay, let's get into acne mechanica. You said you had mentioned that, and sort of, is that what's going to happen to some people if they sort of have that rubbing?
Right. Yeah. So we are seeing this kind of acne this is one of those diseases that span both our healthcare workers and our frontliners and our non-healthcare workers and the public in general. We are just seeing a crazy uptick in acne mechanica, which has a fun new name called Maskne. I don't know if you've heard of Maskne before, but it's mask-induced acne. But the technical
is that
name,
real, or is that like it's clinical?
So it's not like in the books. It's not like in my dermatology books, but that is the layman's term that everyone's calling it right now, which is really creative. But the real name is acne mechanica, and it's acne mechanica is not specific to this pandemic or to mask wearing. We've seen it before when in athletes, especially when they're having to wear a helmet. And so pretty much it's anything that's occlusive, that's preventing the skin from breathing, and that's creating an environment where you see acne really flare.
Okay. All right. And so what happens if, unfortunately, either these preventative measures don't work, or, you end up maybe not knowing about them and you're watching this video now. So what can you do once you've developed this?
So first we have to kind of go back and figure out why we're developing it. So it's due to a few reasons, but as I mentioned, it's the pressure from the mask, friction, stretching, rubbing, and occlusion of your skin. So we have to recognize the difference between acne mechanica and your normal acne vulgaris, or even your adult onset female hormonal acne. So hormonal, right. And actually, I know this is off topic, but I just want to tell everyone who's listening, you are not alone, and it's totally normal to develop acne in your 20s, 30s, or 40s, even if you've never had acne ever in your teenage years. So you are not alone out there, and we can help. And there are medicines and there are experts who can help you.
Yes, definitely. And you're not alone, because I'm there with you.
Yeah. And honestly, like all of my friends who are not in medicine have such a big problem with this. It has a lot to do with your hormones, and it has nothing to do with having acne as a teenager. It's nothing that you're doing wrong. It's something you have to change in your lifestyle necessarily. It just comes up. So just come and see a board certified dermatologist.
Yeah. And, there's plenty of dermatologists out there that are going to be able to help you. And I definitely can sympathize with a lot of people who have adult onset acne, because I'm almost 40, and I was like, how am I still getting zits? Like, I thought this was supposed
Right.
to be over. You know, because I had zits when I was in high school, and you know, ended up going
Yeah.
on birth control for that, and actually helped a lot. And just now I'm like, how am I still getting zits?
Right. Yeah, exactly.
But anyway,
Yeah,
back to Maskne.
right.
Um,
So yeah, so this hormonal acne and typical acne, the hormonal tends to come as big, deep cysts along the jawline. That's a common area where regular acne can come up all over the place, but you can typically see it in the T-zone. But this acne mechanica really is everywhere that the mask is touching and occluding and causing issues. So this is compounded by the fact that it's warm weather out there. So sweating, humidity, warm weather, and moisture from your breath, which is trapped in the mask, and it all leads back to skin barrier breakdown. So when the skin barrier isn't healthy, then your skin isn't healthy. So when the barrier is broken down, we lose hydration. Our skin is vulnerable to bacteria and to inflammation, and that's when you start to develop acne. So the physical contact does that. It also clogs your pores. It physically clogs your pores so that your skin can't breathe, traps in that dirt, traps in that bacteria, and then friction sometimes causes comedones to form, which is the dermatologic name for blackheads and whiteheads. So the best ways, so first we'll talk about prevention, and then I'll get into treatment. So again, as I'll always say about almost everything in dermatology, prevention is so much easier to do than it is to play catch up and to treat.
right.
So prevention wise, the first thing you want to do, if you have the ability to, if you're not working in the healthcare field, having to wear medical grade masks, is you want to look for a fabric that's good for your skin. So if you have a history of acne or your skin is dry, I like to recommend a silk mask. So silk, it doesn't cause that friction as much. It glides across the skin very smoothly. Just like, I don't know if you've ever heard of silk pillowcases. People recommend that for wrinkles, and they're supposedly antimicrobial. So same thing. So the less aggressive material on your skin, the less occlusive, the less friction, and it won't leave marks, and it should be better for acne. Now, if you have compromised skin, if you have a history of eczema or really sensitive skin, a cloth mask might be the best bet, the best way to go. It's comfortable to wear, it's soft on the skin, and it absorbs that moisture. So like I had mentioned, you get a lot of moisture in this area from wearing the mask, and so the cloth will actually absorb that and help protect that skin barrier. So cloth masks that are tightly woven are the way to go. And I did actually see a random study that said cloth plus silk gave you the best protection against COVID. So maybe try both. But
So like layering them?
yeah, yep,
Oh, wow.
exactly. So like a cloth on the outside, maybe a silk on the inside would be the way to go. But other ways to prevent it, like I had mentioned before, now's not the time to wear makeup. I mean, you can't even see below your face anyway. So you just do the eye makeup. No one can see underneath
Yep.
that anyway. If you have a mask that's disposable, only wear it one time and dispose of it. I know we don't have that luxury, or at least a lot of healthcare workers don't have that luxury with an N95. But if you have a cloth mask, please make sure you're washing it after every use, especially if you've worn it for a long time, if you were sweating while you were wearing it, and especially if you decided to wear makeup with it. If you have the ability, I also recommend taking mask breaks. That's crucial to give your skin that breathing ability, to allow it to breathe, so you can get rid of some of that humidity that's there. And even people who are wearing those cloth masks, they can do silicone gel strips too. There's no harm in doing that as well.
Yeah, totally.
So,
And so then what do we do sort of on the treatment end? You know, of course we definitely want to prevent, but you know,
right.
if someone does have this.
So there are a lot of treatments for acne that can be pretty aggressive and dry your face out, and you go through this growing phase and this treatment phase where your skin is worse before it gets better. So now's not the time to mess around with that. So it's better to go gentle and to take your time to get rid of this and to go to go aggressive with it.
Okay.
So like I mentioned for the healthcare workers, as gentle as possible. So I do recommend just washing your face with a very gentle cleanser and using moisturizers and sunscreens that are non-comedogenic. So that non-comedogenic means it doesn't form acne. So most products will say this on it, and if it doesn't, don't buy it. So after you're done wearing the mask, make sure, like I said, you wash your face. Gentle cleansers, I like CeraVe, Cetaphil, Vanicream, La Roche-Posay. They all make these hydrating cleansers, which I really like. Two different products that you can use with active ingredients. I would look for salicylic acid, which is a beta hydroxy acid, or you can look for something with sulfur. So sometimes we recommend a benzoyl peroxide wash in dermatology to treat acne, but that's pretty drying. So now might not be the time to do that. Plus panoxyl, which is benzoyl peroxide, that really helps a lot with the deeper red inflammatory acne, and we're looking more for that acne mechanica, those comedones. So salicylic acid is fantastic to help with that. Make sure you're not overusing it though. Once a day is totally fine. I really like the Neutrogena oil-free acne wash pink grapefruit cleanser.
Yeah.
Fantastic. For sulfur, they have really great prescription ones, so you can get that from your dermatologist, or they actually have a sulfur soap on Amazon, which is really cheap, and it works well, not just for acne, but rosacea, for perioral dermatitis, for seborrheic dermatitis. So sulfur, old medicine, but tried and true, works like a charm, and it's actually very gentle for your skin. So if you have sensitive skin, that's the route to go. So now that we've covered the washing and the moisturizing ingredients, if your skin is dry, the skin barrier is broken, you want to look for hydrating serums. So active ingredients to look for: niacinamide, that helps a lot with redness, especially if you have a touch of rosacea too, or if you're really inflamed from your acne. Antioxidants help, so vitamin C and vitamin E, things with hyaluronic acid, azelaic acid, those are all good options. So that's what I would recommend for the morning. In the evening, again, wash your face, a moisturizer, a hydrating serum. But I would recommend something, especially to help with those comedones, would be tretinoin, a retinoid, which is a tretinoin is a retinoid, or adapalene. So the tretinoin.
Those are prescription, or those are over the counter?
Both. So tretinoin is prescription only, but adapalene now actually in the past few years was prescription, but is now over the counter. So it's a great, more gentle alternative to tretinoin. So my two favorite ones that I like Differin, which makes one, and then the Roche-Posay just came out with an adapalene 0.1%. So the key to using tretinoin and adapalene and retinoids right now is you're already using it on skin that's compromised. So those medications are very drying initially. So I tell people only use it once or twice a week at first. So when you use it every single day and you start out using it very aggressively, it's too much for your skin. It's just very drying. So once or twice a week is the way to do it. I have them wait 20 minutes after washing their face, because when your face is really damp and wet, it absorbs a lot of product. So you want to make sure that you're waiting so that that doesn't happen. Another trick is to only use a pea-size amount. You want to avoid the sensitive areas like your eyes, your nose, and your lips. And then a moisturizer sandwich. So that works really well. So it's easy to remember. So moisturizer, your retinoid, and your moisturizer again. So as your skin starts to get used to it and you start to tolerate it, then you can bump up to nightly. But I always tell my patients, especially now more than ever, that it is a marathon, not a sprint. And so
Yeah.
you don't want to do more harm than good when you're trying to treat your acne.
Yeah, because a lot of these medications can actually be harmful if they're not used correctly.
Exactly. And sometimes I just want to remind people that acne, when you're treating it, can get worse before it can get better. And it might take a few weeks to see an improvement. So please don't expect that you're going to start this new regimen and you're going to see poof, gone acne overnight. It will take anywhere between 4 to 8 weeks to see an improvement, especially if you're continuing to wear that face mask and you're not removing that offending agent. So there's only so much you can do.
Yeah, totally. And it's going to be a continued effort, I think, as we go forward into the next year, possibly 2 years, who knows. And I think masks will probably be here for a while, maybe, here to stay, unfortunately, at least for the foreseeable future. And, before we wrap up here, any final sort of tips on the mask use? I definitely want to also spend some time so we can just, let everyone know where to find you. But any final tips in terms of mask use? I know you said prevention is key.
Mm-hmm. So now is not the time also to be playing around with a new skincare regimen. I know we just talked about adding a few things, but you just want to be as gentle to your skin as possible. Don't be starting a whole new 10-step skin regimen program. I know you really want to try to get rid of that acne or those issues, but you could, like I mentioned, cause more harm than good. And what you may be experiencing may not be acne or maskne at all. So if you try some of these tips and tricks and they don't work, it's crucial that you see a board certified dermatologist for a diagnosis. I've been seeing an uptick in allergic contact dermatitis. People are washing their masks in bleach, and bleach can cause an allergy to your skin. Formaldehyde is a big allergen too, or just irritant contact dermatitis, or a flare of your eczema, a flare of rosacea, or a flare of seborrheic dermatitis. So these require different treatments. So don't just keep pushing ahead if things aren't working. There are a lot of things that look like acne. Mm-hmm. Rosacea is commonly misdiagnosed as acne. So you want to make sure you're treating it the right way.
And do you think any of these lend themselves to televisits at all for anyone who's a little nervous to come in?
Absolutely. So these are the perfect diagnoses and diseases to be seen by a dermatologist on telemedicine. So many of us have that option right now to do telemedicine, which is phenomenal. You can be seen in the safety of your own home without having to leave your house and get a diagnosis. Just one quick thing about telemedicine though, sometimes it's important that you take pictures beforehand and send it to your dermatologist because video isn't always the clearest. Mm-hmm. So pictures, a well-lit room, good internet service, have your questions ready to go, and make sure you have a list of your medications when you sitting right by your side. So no excuse when people sometimes come into the office, they're like, that blue pill, but you're at home. So put it right next to your computer when you do your visit.
I've gotten tours of people's houses as they're like, hold on, let me go to my medicine cabinet. I'm like, okay, hope I'm not seeing anything I'm not supposed to see. But no excuses. I like that. Well, thank you so much for your time today. Really helpful tips. And it's really a problem that I think is under-recognized. And I hope that we can, help more and more. I know this is geared towards women's health, but of course there's, men and women that are wearing masks. And so hopefully it's helpful to a lot of people. And, if anyone wants to find you, what are the best sort of ways to reach out to you? I know you're on Instagram. Any other, if you want to mention your social handles as well as your practice information.
Yeah, so my Instagram is based on education and dermatology tips. So everything is backed by science that I recommend. So my handle is @dermguru. So it's all one word, dermguru. So I'm happy to, if you want to ever direct message me, I'm happy to take any questions there. And I'm really passionate about dermatology. You can see that through my account. And then through my social media handle on Instagram, you can find my office website. You can find my office phone number and address. So I am seeing patients via telemedicine, and I'm seeing patients cautiously in the office. All the protective measures are in place. We're wearing masks, we're wearing gloves, temperature checks at the door. So I'm happy to assist anyone in the Pittsburgh area who needs help, or if you need help finding a dermatologist, please reach out to me and I will gladly find you one.
Yes, definitely. We have a few more dermatologists who are joining us as well for this summit. So all located in different areas. So we'll definitely get you their information as well. But thank you so much. I mean, this means so much for you to spend, your precious time to do this and talk about this subject. And I know it's going to help a lot of people, and you've already helped me. I'm like thinking now about, I'm like, oh, I definitely do a lot of things she mentioned not to do. I'm one of those people who I'm like, I need to hit this hard. And then I'm like, why didn't it work?
Right, exactly. You give it like 3 days and you're like,
Yeah.
I'm done with it.
Yeah. So I'm definitely guilty of a lot of those things. So thank you so much. And, really, really appreciate all your help. And we'll definitely be talking more about this as we unfortunately go into a world where we're going to be using a lot of masks. And Maskne, while it's a funny nickname, is unfortunately a real problem for a lot of people.
Absolutely. Well,
Thank
thank you
you.
so much for having me. It was really an honor and I enjoyed chatting with you.
Oh yeah, it was great. All right, take care.